The Omicron variant, now officially the dominant variant of COVID-19 in the U.S., according to federal health officials, accounting for 73% of new infections in the week ending on Friday. Joining us now for more is internist at Northern Westchester Hospital, Dr. Frank Contessessa. Your first time with us, Doctor. Good to have you on the show. Good morning.
Good morning, Rob. Thanks for having me.
Has anyone ever had difficulty saying your last name before? I imagine that's never
happened.
It
happens. Sometimes I just go by Dr. Frank. It's a little bit easier.
I like that, Dr. Frank. Well, we appreciate you being with us this morning. The president is going to address the nation at 2:30 this afternoon. The speech was billed as incredibly urgent, but apparently it was so urgent that it could wait a day. He could have given this speech on Saturday or Sunday or, of course, yesterday. What do we need to hear? What do the American people need to hear from the president? He's had the ball with COVID-19 for more than 11 months. We've had more deaths under Joe Biden's watch than we did his predecessor. What do the American people need to hear today?
The American people need to hear that there's a need to remain calm. The American people need to hear that there's no need to panic with Omicron. I've heard you say before, it looks like it's a milder form. It's enormously transmissible. I mean, you just mentioned a few minutes ago that the dominant strain now has become Omicron very quickly. A week ago, it was about 12%. Now, we're up to 70-something%. That's remarkable. So it's a testament to how fast this virus is going to spread through the population. But being a milder form, that's not necessarily a bad thing. Going to confer natural immunity and herd immunity to the population. And this just may be our ticket out.
I'm wondering if you think some of the rest of the country has moved on from coronavirus. If you go to other parts of this country, people are living their lives. Has this become a virus that exists, around the Beltway in D.C., New York, and California? I was reading some numbers. According to the CDC, the average American has a 1 in 26,000 chance of showing up at the hospital with COVID. And if you do, the average age of somebody hospitalized is 73 years old. So for a lot of Americans without comorbidities who are younger and perhaps healthy, can't they just go about living their normal lives even with this endemic virus?
Absolutely, Rob. COVID does not affect all groups equally. Across the board, you're looking at really just a 0.5% mortality rate. But that's a little bit that's a little bit confusing because it affects the at-risk populations, the elderly, the obese, about 1,000 times more. It's about 1,000 times deadlier to the at-risk populations. So if you're looking at younger, healthier populations, it's really a very small risk, and people really do need to start going about their lives. I think the constant drumbeat of panic is getting to people, and I think they're starting to see through it. They know people now who've had it and recovered, or they've had it and recovered themselves, and they realize this is not the terror that we're being led to believe that it is.
Why so many breakthrough cases?
The breakthrough cases are happening because the vaccines are showing diminishing immunity, diminishing efficacy against the variants. They are so mutated now. Omicron is virtually a different disease now than the earlier strains. They're so mutated, especially at the spike protein, where the original vaccines were designed to attack. So we're going to start seeing that, and people are realizing that. They're starting to see that, wait, I had 2 vaccines and a booster and I still got COVID. Right. Or my family member had 2 vaccines and a booster and still got COVID. Why should we keep getting these things?
All right, Dr. Frank, great to have you on the show. We appreciate it. Come back and see us soon. Merry Christmas if we don't see you. Thank you.
Merry Christmas to you. Thanks so much for having me.